It is nurses that are the backbone of acute care and healthcare and primary care. We are the ones who provide the care and the education to the patients.
Technology is advancing at a very fast rate, and so is knowledge. So therefore techniques are improved.
My biggest challenge would be sharing knowledge that I know is current, backed by research and easy to access.
And there's more and more pressure on nurses now to do a lot of this, seeking information and improving their skills themselves in their own time rather than work time. Between wards there doesn't tend to be a great difference in variance, but between hospitals there can be.
There's lots of children out remote, rural, metropolitan Sydney who don't actually have access to the tertiary centres. And how do we actually make that care consistent?
Any director of nursing that was going to make something simpler for the staff and at the same time have it done right would be seeking uniformity across the board.
Our ward still has paper copies of policies and procedures, plus we also have computer access to this network which is meant to be easy to find things. But as a nurse, when I go to the computer, I tap on procedures, I type in pick dressing, nothing comes up.
When I first started, all their resources were hard copy and they were out of date.
We're still very reliant on the old printed copy of a particular procedure, if we're talking right down to the bedside level.
Obviously we've got our policies and our procedures which are more mandated documents, but I think nurses on the floor especially find it really difficult and challenging to be able to access that on a day-to-day basis.
Variability of care in healthcare is a huge issue on a global basis. We are here today at the Australian College of Nursing, the National Nursing Forum, and we're pleased to announce our partnership with the Australian College of Nursing and our Lippincott Procedures product. We partnered with the Australian College of Nursing because it was very, very important that we chose the leading nursing society within Australia. We needed to make sure that the procedures were localized to the Australian market. We've also partnered with AusMed Education, which is helping us to put a continuing professional development button on our procedures so that when nurses complete the tests and the skills checklist within the product, they can go on and then obtain their continuing professional development credit. It's really important that nurses understand that they need to keep learning each and every day. Having the ability to earn CPD credit when they're looking up a new procedure so they can stay up to date with the latest advances in healthcare will give them an incentive then to actually achieve their CPD credit.
Nurses don't have the time to canvass what's out there as far as evidence is concerned, so they really need a one-stop shop, something that can compile that evidence and give a really good summary around what the best and most relevant and evidence-based practice is out there.
Everybody wants the same thing, the best outcome for the patient.
Every hospital has a different procedure, but the bottom line is you've got a patient to care for. You need to know that information then and there.
One source of material, one standard of training, one resource would be the best because there's no confusion.
The ability to make decisions, especially for our novice practitioners, is really, really hard in that heat of the moment. And then you've also got experienced clinicians saying, oh no, we do it this way. Well, this is the way we've always done it. And that's a real challenge for new practitioners coming through. So if there's resources that are evidence-based, they're obviously up to date, they're easy to access, quick, back to the bedside to help them make that clinical decision, I think that can benefit them all.